For our movement analysis project, we compared and contrasted two subjects with different anthropometrics lifting a light and a heavy box from the floor. We divided our analysis into 4 phases. Phase 1 is the initial squat, and the first joint is the coxofemoral. For the osteokinematics, we have a ball and socket joint working in the sagittal plane where the convex femur head flexes on concave acetabulum. The extremes of full flexion are limited by posterior inferior capsule, and full flexion causes posterior pelvic tilt and some lumbar spine flexion. Arthrokinematics involve femoral head spinning around the medial-lateral axis that pierce through both femoral head and acetabulum. Active range of motion norm is 120 degrees for hip flexion. The muscles are being used eccentrically is the quadriceps group, concentrically hamstrings, glutes, glute max, and hip adductors. Hip abductors are used for stabilizing the leg. For the tibiofemoral joint osteokinematics, we have a hinge joint where the convex femoral condyles move posteriorly into flexion on concave tibia. For arthrokinematics, convex femur rolls posteriorly but slides anteriorly on a concave tibial condyles around the medial lateral axis. Active range of motion norms for a full knee flexion is 135 degrees. Muscles that are being used primarily eccentrically are the quadriceps groups. Concentrically, it's going to be hamstrings, sartorius, gracilis, popliteus, and the pens muscles, as well as abductors being the muscles stabilizing the leg.
Now for the talocrural joint, the osteokinematics is a concave tibia moving anteriorly on a convex talus in a dorsiflexion motion. The axis of rotation passes through the body of the talus and through tips of both malleoli in the sagittal plane. The arthrokinematics is a concave tibia rolling and sliding anteriorly on the convex talus with an AAOS norm of 20 degrees of ankle dorsiflexion. The muscles used here is an eccentric contraction of the gastrocnemius and soleus muscles.
Now looking at the lumbar and thoracic spine movements for the initial squat, the arthrokinematics of these plane joints include the top vertebral facets extending over the bottom vertebral facets in the sagittal plane. We see here extension of the lumbar and thoracic spine, which the arthrokinematics include the inferior facet of the top vertebra sliding inferior and posterior on the bottom vertebra. The AAOS norm is 25 degrees using an inclinometer for thoracic lumbar extension, and the muscles used for this movement are the erector spinae and transversospinalis group. Now, looking at the lumbopelvic rhythm for the initial squat, this is seen throughout the squatting motion. In the early phase, we see a lumbar extension, and towards the later phase of the initial squat, the hips begin to flex. This is a combination of osteokinematics and arthrokinematics as it involves the joints of the lower spine, the SI joints, and coxofemoral joint as well. The muscles used are the lumbar erectors, gluteus maximus, and the hamstrings. Now, there are also differences seen in the same individual lifting the light versus the heavy box. We see a wider base of support during the initial squat for the heavy box. The weaker individual has greater knee flexion with the heavy box, and there is greater lumbar extension and an anterior pelvic tilt in the weaker individual when squatting for the heavy box. There are also differences seen in the strong versus weak individuals. The stronger individual has a greater hip flexion, as we see he is bringing his shoulders over his toes.
So now we're going to be looking at phase 2, which is a full squat. The first joint we're going to look at is the coxofemoral joint. And as we stated earlier, the osteokinematics and arthrokinematics are very similar. We have a ball and socket joint. The femoral head will move anterior on the acetabulum, and then for the arthrokinematics, it spins. The norm is 120 degrees for hip flexion, and the muscles that we're looking at here, concentrically, shortening will be the iliopsoas, rectus femoris, and sartorius, which are our flexors. Eccentrically, we're going to be looking at the glutes, all three of glute max, glute med, and glute min, as well as the hamstrings as the extensors and abductors. And then I also put the adductors there as well. Longus brevis and magnus and gracilis, as we can see in the pictures, our subjects have their legs abducted. Next, we're going to be looking at the tibiofemoral joint, and this is similar through the osteo and arthrokinematics, a hinge joint moving posterior and the femur rolling posteriorly but sliding anteriorly. The norm is 135 degrees of knee flexion, and the muscles here we're looking at eccentrically include the quads, concentrically include the hamstrings, and then gastroc and popliteus. The last one we're going to look at is the talocrural joint. Osteokinematics include hinge joint and the tibia moving anterior, while the arthrokinematics is a concave mortise rolling and sliding anteriorly in the talus. The norm is 120 degrees of ankle dorsiflexion, and the muscles we're looking at here eccentrically include the tibialis posterior, fibularis muscles, and gastrocnemius. Concentrically, we're looking at tibialis anterior. Lastly, we're going to take a look at the comparison. When lifting the heavier load, both individuals start with the box closer to their body. And as we see, the weaker individual has it closer than the stronger individual. The weaker individual also has a noticeable increase in their hip and their knee flexion when lifting the heavier load compared to the lighter load.
Now we'll talk about phase 3, which is the initial lift of the boxes. The coxofemoral joint has the same osteokinematics as phase 1 and 2, except for this time the femur moves posteriorly on the acetabulum of the pelvis in an extension motion. The arthrokinematics is a spin of the convex femur on a concave acetabulum around a medial to lateral axis of rotation. The AAOS norms is 20 degrees of hip extension, and the muscles that are used is gluteus maximus and the proximal hamstrings. For the tibiofemoral joint, the osteokinematics is again a hinge joint, and the tibia moves anteriorly around the femoral condyles in an extension motion. The arthrokinematics is a concave tibia rolling and sliding anteriorly on a convex femur around a medial to lateral axis of rotation. The AAOS norms for knee extension is 0 degrees, and the muscles that are used concentrically are the distal quadriceps. For the talocrural joint, this is again a hinge joint. The mortise, which consists of the tibia and the fibula, moves posteriorly over the talus in a plantar flexion motion. The arthrokinematics is a concave mortise rolling and sliding posteriorly on the convex talus around a medial to lateral axis of rotation, with a 50-degree AAOS norm for plantar flexion, and the muscles being used concentrically is gastrocnemius and soleus. For lumbar and thoracic spine, the arthrokinematics is a plane joint, and the top vertebral facets flex or extend over the bottom vertebral facets within the sagittal plane. The arthrokinematics are different for the light box versus the heavy box. As for the light box, we see more of an extension. So the inferior facets of the top vertebrae slide inferiorly and posteriorly on the bottom vertebrae. As for the heavy box, we see more of a flexion motion occurring. This means that the inferior facets of the top vertebrae are sliding superiorly and anteriorly on the bottom vertebrae. The AAOS norms for both lumbar and thoracic flexion is 60 degrees, and thoracic and lumbar extension is 25 degrees when using an inclinometer. Muscles used for flexion are the abdominals, and for extension are the erector spinae and transversospinalis groups. For the initial lift, a more anteriorly tilted pelvis can be seen when lifting the lighter load, whereas a more posteriorly tilted pelvis is seen when lifting the heavier load. Throughout the lifting motion, a lumbopelvic rhythm can be seen. In the early phase, the hips start to extend, and then in the middle phase, the lumbar extends. This is a combination of osteokinematics and arthrokinematics, as it involves the joints of the lower spine, the SI joint, and the coxofemoral joint. Muscles used for this action include the lumbar erectors, gluteus maximus, and the hamstrings. For the comparison, the differences seen for just the individuals between the light box and the heavy box include the following. The base of support is greater with the heavier load. They hold their box closer to their body when lifting the heavier load versus the lighter box. There is greater lumbar and thoracic lordosis when lifting the lighter box, and greater lumbar and thoracic kyphosis when lifting the heavier box. The differences seen between the strong versus the weak individual are as follows. The weaker individual can be seen with greater lumbar and thoracic kyphosis when lifting the heavier load than the stronger individual. The weaker individual is seen with a much greater base of support than the stronger individual when lifting heavier loads, which increases the abduction motion that's occurring at the hips. The weaker individual shows signs of straining in the muscles of the neck that are not seen in the stronger individual as well.
Okay, next we are moving on to phase 4, which is the full standing position. For the coxofemoral joint, the osteokinematics is a posterior pelvic tilt. The femur moves posteriorly on the acetabulum. For the arthrokinematics, the acetabulum spins. The AAOS norm is 20 degrees of extension. The muscles used concentrically are the gluteus maximus and the hamstrings. Next, moving on to the tibiofemoral joint, the osteokinematics is that the femoral condyles move anterior on the tibial condyles. The arthrokinematics is the convex femoral condyles roll anterior and slide posterior on concave tibial condyles. The AAOS norm is 10 degrees of hyperextension. The muscles used are the quadriceps. Lastly, for the talocrural joint, the osteokinematics is that the tibia moves posteriorly on the talus. The arthrokinematics is the concave tibia rolls and slides posteriorly on the convex talus. The AAOS norm is 50 degrees. The muscles used concentrically is the gastrocnemius and soleus. So when comparing both of our subjects for phase 4 with the light box and the heavy box, the weaker subject with the lighter box is able to keep the box further in front of her body. With the heavier box, the subject brings the box closer to her body and has to extend her trunk more. For the stronger subject, he was able to keep his arms extended in front of him for both weights, however, still extended his trunk with the heavier box.